Breast cancer is the most common cancer in women worldwide, according to the CDC, and our risk increases with age. However, if found and treated early, it is highly survivable. Dr. Alisha Rathi is a breast imaging radiologist with Moffitt Cancer Center, and she is here to remind us about the importance of screening. Great to have you with us.
Thank you so much for having me, Stephanie. It's great to be here.
Why are mammograms so important? We hear it all the time, but we don't necessarily absorb it.
Exactly. You know, mammogram is the most effective tool we have at early breast cancer detection. And the reason early breast cancer detection is so important is because it's important to catch breast cancer before you may have symptoms, or sometimes years before you even feel a lump developing. And that's why we have annual mammography screening that's recommended starting at age 40. If we can get you in for screening, if you are average risk, starting at age 40, it gives us a chance to detect breast cancer early on so that you have the most treatment options available for you for your care.
What is the mammogram seeing that I can't feel, there's no lump, I have probably no idea it's happening? What are you reading on that?
Exactly. So what mammograms allow us to do, there's a lot of different factors, but it allows us to catch breast cancer before it's detected by you, before you can feel it. And there's a lot of different ways we can do that, where you can see sometimes a mass, or you may just see the beginnings of a mass sometimes. And that's what helps us eventually be able to diagnose it early on.
And keeping it localized seems to be the most important predictor of outcome.
Exactly. So because we have mammography and because we have early screening starting at age 40, we can detect it early on. And if we detect it early on, we have the opportunity to have it localized. We have treatment that can help it localize to one area before it starts spreading to other areas of your body.
Okay, so I know one of the big exciting things happening this year at Moffitt Care Center is the opening of the South Shore campus. When it comes to annual screenings, diagnostic procedures, will we be able to do these at South Shore?
Absolutely, and that's why we're so excited about the Ruskin facility opening at South Shore. Not only will we have screening services such as mammogram, but we'll be able to bring cutting-edge research and enhanced patient experience to you at a location closer to so many of our patients here at Moffitt.
So I can get my screenings there.
Absolutely.
Should something be found and then treatment ensues, how much of that treatment will be able to be done at the South Shore location?
You will be able to have the full spectrum of experience at Moffitt Cancer Center at the Ruskin South Shore location, from your screening to your diagnostic treatment, as well as the ultimate treatment plan.
And that is so important, you know, when you're dealing with something stressful, obviously, as any form of breast cancer would be, to be able to have that closer to home. In your experience and research, why are survival rates getting better? How are we doing a better job managing breast cancer?
That is a fantastic question, and it all comes back to screening. And that's why it's not only important to have your screening started at an early age, but it's also important to have something called a personalized risk assessment performed. Because while we recommend screening starting at age 40 for average risk women, for high-risk women, we recommend screening start earlier, and you may also need something in addition to a mammogram, such as a breast MRI. So the American College of Radiology actually recommends that you start your breast cancer screening assessment at age 25, so we can get you the best treatment options earlier on.
Oh, so this is something we'll start to discuss younger on then. How do we do it? Do we get OBGYNs on board? And you know, it's hard to convince a 25-year-old of something life-altering like this.
Completely agree. So there's a few ways you can go about it. One is to go to your primary care provider, and they can perform a personalized risk assessment for you. One of the beautiful things we do at Moffitt is when you come in for your screening mammogram, we ask you a series of questions, and those questions help us perform a risk score for you. And that lets us know, are you high risk or are you average risk? And if you are high risk, we can make the appropriate recommendations to you of whether you need a mammogram or an MRI or both.
And I feel like at this point, most intelligent women know they need to get mammograms after age 40. But yet many do not. Why the disconnect?
Yeah, you know, I think that it's a variety of factors, and it's obviously a very stressful thing to be able to even honestly go to the mammogram center and be there getting your mammogram. It's a very stressful experience because you don't know what you may find, and you don't know sort of what your life will look like after. But I think that patients do a wonderful job of advocating for themselves and going to the center. And Moffitt is great in that because everyone in our team is dedicated to the best patient care and providing a great breast experience for you from the beginning to the end. So whether it be when you're coming in from your screening, we're dedicated to have breast imaging radiologists read your mammogram, as well as the best treatment options available for you should you need it.
And I think we better say, too, it doesn't hurt.
It doesn't
I've had several. It does not hurt.
Exactly.
So hopefully that's a little less, you know, of things for people to worry about, because we really do want everybody to go ahead and get screened. And I love the fact that there's now the option of the South Shore campus in Ruskin for Moffitt Cancer Center, and for your screenings, especially those related to breast, you can go to moffitt.org/bookmymammogram.